During fetal growth in the womb, the testes develop in the abdomen. Before birth, the testes typically descend from the abdomen into the scrotum, the thin pouch of skin behind the penis that normally holds the testes. Undescended testes are when they fail to drop naturally into the scrotum before birth or within the first 6 months of life. Another name for undescended testes is cryptorchidism. About 2 to 3% of newborns have an undescended testes. The condition is more common in premature babies, where according to the Kenya Demographic and Health Survey, 1 in 32 preterm babies have undescended testes. Dr. Temi Jumbi, a pediatric surgeon, explains.
There is a hidden prevalence, and especially in low middle income countries, where there are boys out there with undescended testes, but they don't know and the parents don't know. So that is a hidden prevalence that cannot be accounted for. But the general figure, statistically speaking, is 3% of boys have undescended testes.
According to Kenya Association of Urological Surgeons, an undescended testes is seen in 4% of boys at birth. Spontaneous descent occurs in 75% of these boys over the first 3 to 6 months, leaving 1% of all boys with an undescended testes after this time. The main symptom of undescended testes is the absence of a testicle in one or both sides of the scrotum. However, Dr. Jumbi says some of them will present with growing pain.
This growing pain is because the testis, most of the time, sits around the groin, somewhere where you would put your belt, okay? And they would complain of some vague, constant pain along that line, that groin line. And now when they come for examination, we realize that they don't have testes. And when you examine, you find the testes along that line.
Healthcare providers and medical researchers aren't sure why some babies have undescended testes at birth. The exact cause is often unknown, but it can be related to hormonal imbalances, genetic factors, or developmental issues during fetal growth.
Interestingly, you can have twins who are male, both of them, one having undescended testes, the other not having undescended testes. And so you would argue, they were in the same womb, so why would this one have and this one not have? And that's why we have come to a conclusion that you cannot pinpoint the exact cause of undescended testes.
There are several potential consequences of having undescended testes, the main one being infertility.
Indeed, we have done studies that have shown that patients who have undescended testes are at a risk of being subfertile more than the general population of boys that don't have undescended testes. And in terms of timeline, you want to correct the undescended testes before 1 year of age, because studies have been shown, and these studies have proved that when you are past 1 year of age, the fertility risk, or rather the infertility risk, starts getting more and more and more.
However, parents are encouraged to take their children for surgery even if it is diagnosed at a later age.
As human beings, we can't really say that, this one is past 1 year of age, so the fertility is gone, That is probably beyond us. Our job is to make sure that they are in the scrotum, at an appropriate time, so that we can take care of that fertility risk.
Other consequences of having undescended testes include increased risk of testicular cancer, which affects males between 15 and 35. Testicular torsion, this is when an undescended testicle is more likely to twist, cutting off blood supply and causing severe pain, and the testes may die without immediate treatment. Inguinal hernia. This is when an undescended testis can increase the risk of a hernia in the groin area. A physical examination is usually sufficient to diagnose undescended testes. Doctors may also use imaging tests like ultrasounds to locate the testes. Whose responsibility is it to diagnose undescended testes?
For the mother and the father. Every time you are washing the boy, so you're going to put the child on a bath. Every time you're washing a boy, that is the best opportune time you have to examine for undescended testes. And I'll tell you why. So when you're putting the child on a warm bath, the scrotum tends to sag because of the warmth, and you're able to see the testes descend very well in the scrotum. So if the testes don't descend well in the scrotum, when the child is on a warm environment, like on a warm bath, then probably your child needs a checkup, okay? Now for the healthcare practitioner, any boy that comes to you for any condition, so they've come because they have a cough, they've come because they have a fever, they have come for their regular vaccines, that is an opportunity for you to go down, remove that diaper, and check the scrotum for testes.
There are cases where a mother is sure that her baby had testes on the right place, but later on in life, she realizes the baby's testes have ascended.
Now, there are testes which are detected at birth, but later on they ascend. And this is a special category called ascending testes. And it is quite common than you think, and it probably has something to do with body growth.
Most often, an undescended testis is fixed with surgery. The surgery is called orchidopexy. It can be done through a small cut in the groin, the scrotum, or both.
The surgery is quite tolerable in children. It is done under general anesthesia, and it is a surgery that can be done as a day case. That means that you can come in the morning, we offer you the surgery, and you go home in the afternoon. It will require a small cut, maybe around 2 centimeters. Then once we identify where the testis is, we bring it down and we fix it there. Recovery time is probably around a week, and the child should be back to their normal activities and also their normal school activities.
How effective is the surgery?
The surgery itself is almost 95% effective if done in proper setup with proper skill set. So this is surgery mostly offered by pediatric surgeons, urologists, and general surgeons.
The cost of the surgery ranges from 40,000 shillings to 200,000 shillings depending on the medical facility that is offering the surgery. Nuru Abdulaziz for Willow Explainers.